Dr. Kavita Patel was a health policy advisor in the Obama administration. She's a primary care physician and an NBC News medical contributor. Dr. Patel, good morning. It's great to see you. Happy New Year. It's hard to believe we're now entering year 3 of talking together about COVID, about this pandemic. But here we are as we turn the corner. Yes, Omicron is spreading, but as we just heard in Morgan's piece, it's not as many hospitalizations and thankfully not as many deaths. So how are you feeling as we head into a pretty important day tomorrow with schools reopening out of the holidays and millions of people coming back home from gathering?
Yeah, Willie, Happy New Year to you, too. Or as I like to say, thank goodness we got through 2020 and 2021. So I'm really nervous, but optimistic that schools have good plans in place, testing, masks, requiring adults to be vaccinated if possible and boosted. And if you don't have these measures, I'm incredibly worried about how quickly this could spread and shut some schools down, unfortunately. But if you do have these mitigation measures in place, Willie, we're all kind of hoping, my own children included, we're trying to think about how to maybe even start virtually just for a few days, Willie, to wash out this New Year's Eve period, and then give people time to get tested, or if anybody has symptoms, to not come in. And then that can get us off to an even better start.
So record-breaking cases, Dr. Patel, but not as many hospitalizations and deaths as we saw last year and the year before. Is that because so many of us are now vaccinated, or is it because Omicron seems to be less severe than other variants?
Yeah, it's still too soon to kind of tell and put the books away on what that is. But the early signs do point to the fact that while Omicron is very easy to give and get because it can be in your nose much more efficiently and in your throat, so you can give it to people more easily, that it also just kind of stays in those upper airways, Willie. So all those images and kind of scenes that we recall all too vividly of people on ventilators because of deep pneumonias, we're not seeing that with Omicron from some of the earliest animal and kind of human trials and results that are present. So that's good news. But at the same time, we're going to see over the next several weeks so many cases, and that is just going to overwhelm everyone. And in your point, vaccinations do work, especially boosters. But with only about a third of the country that's gotten a booster, Willie, and a third of the country that's still totally unvaccinated, we have a lot of people exposed. So I don't want people to get complacent and write this off as a mild disease. But most of us, if vaccinated and boosted, it'll feel like a really bad cold and stay in that upper airway. But it can knock some people out. I've had a lot of patients that felt, just pretty down for several days.
Quickly, before I let you go, Dr. Patel, you mentioned schools, some districts closing already as a precautionary measure coming out of the holidays. A lot of parents saying, here we go again. We don't believe you'll be closed for 2 weeks. That's what they said 2 years ago today, that time. So how should schools be thinking about this? Testing would be great, but we know how hard it is to get that many tests. What should schools be doing right now?
Yeah, obviously testing is great, but otherwise what we call Swiss cheese kind of mitigation. We're doing a little bit of everything in a smart way. Ventilation, open windows, outdoor eating where possible, making sure kids are wearing their masks properly. It does make a difference. And having households vaccinated. Willie, we found that when children are unvaccinated in hospitals, which we are seeing, by the way, that we often find the entire household is unvaccinated, and that can leave a lot more people vulnerable. So we can keep students in school, be clear about that, but we have to do it safely, and it's possible.
Let's hope they stay open. Dr. Patel, great to see you. Thanks so much for being here this morning.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.